Well, welcome to the Daily Brief on Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. My name is Tim Sheehy. I'm president of the MMAC, and I'm joined by my co-host, Dr. John Raymond, president of the Medical College of Wisconsin. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC. Today, our special guest is Ann Christensen, director of the North Shore Health Department, and she's going to talk a little bit about the role of public health in COVID-19 policymaking. But we'll start, as we always do, with an update from Dr. Raymond.
Thanks, Tim, and good afternoon, everybody. This first slide summarizes the various indicators of COVID-19, and these are as of today, and I'll run through these quickly. The doubling time for COVID-19 continues to improve to 15.5 days in Wisconsin and 19.9 days in Milwaukee. The daily growth rates over the last 7 days also have improved slightly to 3.1% in Wisconsin and 2.8% in Milwaukee. There were 193 positive tests in Wisconsin today, down to the lowest number this month. There were 47 new positive tests in Milwaukee, also down significantly, and 34 new cases in Brown County, which is stable. Now, I don't believe that these numbers include the new testing capacity brought online yesterday by the National Guard, so we should see those numbers within the next few days. There were 3.9% positive tests out of 4,700 tests administered in Wisconsin yesterday, and that also is the lowest rate of percent positive tests that we've seen since we began measuring the percent positive rate. And there were 11% positive tests in Milwaukee. COVID-19 diagnostic testing capacity remains stable at about 13,800 in the state of Wisconsin. ICU and ventilator capacity remain stable, and they are adequate. And with regard to personal protective equipment, those continue to improve in both Wisconsin and Milwaukee, with the most critical shortage currently of gowns. And with that, I'll turn it back over to Tim.
Thanks, Dr. Raymond. Some really encouraging news. So let's bring Ann in here. And Ann, first of all, you have done your work now on a really bright stage, probably something you're not used to doing in the past, but I just wanted to acknowledge and thank you for your leadership in working with the other 19 municipalities to try to get us to the point where we have a uniform view about how to approach COVID. So thank you for your leadership, and I'll turn it over to you to take us through kind of the role of public health and the impact it's having.
Yeah, thank you. As we've been hearing throughout the last 2 months, COVID-19 is certainly a public health crisis that none of us in our lifetime have ever had to address before. So I think it's really important to frame what is local health, what is public health for the audience. So there are actually 86 local health departments in Wisconsin, and our role is to be a part of the government system to protect and promote the health of all that live, work, and play in our communities. And this figure gives you a sense of some of the broad scope of our work when we are not addressing a COVID pandemic. So communicable disease is certainly at the heart of what we do, and what that means is essentially controlling and preventing the spread of various communicable diseases, everywhere from TB, tuberculosis, to mumps and measles. So that is really our role in terms of protecting the public's health, but we also do things like providing immunizations. We, many of us license the restaurant and retail food establishments in our communities. We work in chronic disease control and prevention, injury prevention, as well as in environmental health. So we really cover a whole broad spectrum of health issues that affect the population. And our role, as I said, is to really make sure that everybody is protected and safe in our communities. We work in partnership with the healthcare system as those partners help to address health on an individual level. And again, our scope is really looking much more broadly at how we can address these both risk and protective factors across a population. And we do that and are guided by Wisconsin state statutes, as well as our local community health assessments and improvement plans, which are really driven by the community that say these are the critically important issues that we want to address. And so local health departments work in partnership with many sectors of our civil society, including healthcare, business, to then address those priority areas that the community has identified. Next slide, please. So in terms of COVID response, so this really shines a light very much on local health departments as well as the state health department system. And we are the primary agencies that respond to public health emergencies, which is what COVID-19 has been declared. And that's under the federal government system. FEMA has outlined that our role is to respond to obviously public health emergencies on a broad level in terms of local, state, and national. And it's part of a broader system. So more specifically, local health departments locally monitor our cases of COVID-19. We are the agency that receives test results and then have the information for our communities about how many people have been tested, how many people test positive, how many people test negative, and all sorts of information around that data. We also then keep the public informed on signs and symptoms. We work closely with our state partners at the state health department as well as CDC to help keep up to date on those ever-changing signs and symptoms. So that's one of the critical roles we play too. We work in partnership then with all sorts of players in terms of our communities, be they the schools, our municipalities, healthcare providers, businesses, and our role with those groups is multifold. We work to identify prevention opportunities with COVID. I was just on the call with many school superintendents this morning and looking to determine ways that they're going to be able to look at their summer school programming, looking at school in the fall, even graduation. So how can they prevent the spread of COVID in those circumstances? And local health departments really are the key players for helping determine whether their strategies that they're considering are going to be effective. Then in terms of controlling the spread, so our role is also critically important. And as I mentioned, we get those notifications about cases. And so we can work with businesses as well as long-term care facilities if they have cases in those places to help minimize the spread throughout a workforce or throughout an institution. And so we're really on the front lines with working with the staff to contain and control the spread in those localized settings. Those are largely what we would call outbreaks that we respond to. And again, as I mentioned earlier, that's what local health departments do on a broad scale every day for communicable disease. COVID-19 is just a situation where we are applying those tools and that work that we do to a very specific setting. And then finally, in the news and media, we've talked a lot about contact tracing and the local health department's role in receiving information about those positive cases and then their contacts. So those contacts are the people that have been exposed to that contact or that person who tests positive. And our role is to understand all of the people and settings that they have been in so that we can then track back and alert those people that they've been exposed in a circumstance and help determine what their next steps are, whether a quarantine is recommended or whether monitoring signs and symptoms is recommended, because those recommendations change based on whether somebody is at a higher level of risk of exposure versus a medium and low. So we work with the public and the community to identify kind of the next steps in those circumstances. And contact tracing is really critical, as mentioned, in varying formats, that we're really putting a circle around that individual and those people exposed to prevent the next layer of transmission. And that's why we've talked so much about contact tracing being that critically important next element. So I'll take the next slide, please. So everybody's asking, what's the next step? Obviously, there's a lot of fluidity in terms of where we are right now. Safer at Home has been in place for, say, a number of months, depending on which order we're talking about. And we do see that there's evidence, and actually Dr. Raymond just pointed to evidence where we see some flattening of the curve and we are seeing some significant impacts. We know that this has been a challenge for us all as a community to be at home, to not be working for the most part, and to taking these social distancing measures to really to keep ourselves at home and keep ourselves safe. And we are definitely seeing those impacts with our cases, with our hospital systems. And so that is definitely a promising thing that we're seeing. And as we've been safer at home, the public health system and the healthcare system has been doing the work to stand up more widespread testing to make sure that we're not surging our healthcare system. And then again, in terms of public health, getting that contact investigation system really up and running on a very broad level. Next slide, please. Next slide. Yeah, thanks. So this really demonstrates from a projection standpoint what would have happened and what has happened under Safer at Home. So when we looked at March, the projections for a large surge would have been true if we hadn't put in a Safer at Home measure in place. We would have really overwhelmed the healthcare system, as well as had a number of many more widespread fatalities than we had otherwise. On the left, it says cases that X-axis is actually should be 12,000 additional cases we would have seen had we not had Safer at Home in place. And what you see with the turquoise line is what we ended up having, and that is because, again, that Safer at Home was in place. And these are data that we observe based on actual circumstances. So next slide. So again, talking about where we go now from here, and with promising data coming out, and we've heard from the governor's Badger Bounce Back program, the need for gradual loosening of restrictions, so that if we looked to do that light switch where we all of a sudden turn everything back on and reopen, we see from the left figure here that we really would be back in a place where we're overwhelming the healthcare system beyond the capacity that is manageable. So we think that it's prudent to continue to do some measure of social and physical distancing. But again, there's a fine balance between doing all physical distancing, which we know under a Safer at Home is not practical for the long term. So we need to think about what that partial or elements of loosening those restrictions would be more on that gradual dimmer switch, which has been discussed as part of some of the Badger Bounce Back programs. So you can see on the right side, this is what our projection would be under some partial reversal of Safer at Home starting May 26th. And again, these are just projections based on what we assume to be in place based on the data that we have currently. So I'll take the next slide. This figure is intended to demonstrate for the Milwaukee County area that the issue of COVID-19 is really spread out for both the city of Milwaukee as well as the suburban communities. As you've heard, I'm from the North Shore Health Department, which we represent 7 suburban communities. And you can see from the right side of this figure that the impact of COVID is fairly equally distributed from the city of Milwaukee and all of the suburban communities in Milwaukee County. So we think that a countywide regional approach is really important as we think of next steps. And one of the reasons we know that is the intermingling of our residents with residents from other Milwaukee County communities. And where we see that playing out is in that contact tracing that I mentioned. So we know from our interviews and our investigation that there are people that work in the North Shore that then reside in the city of Milwaukee, or that there are people that live in the city of Milwaukee and reside in Franklin. And so there's just a whole bunch of intermingling. And so when we see and think about next phases, that if we put in place looser or tightened restrictions in one place, it may have unintended consequences in another place. So thinking more on that regional or countywide approach gives us both clarity of message as well as helps keep the impacts from our social distancing similar across all of our communities. So next slide. So in terms of next steps, and obviously there's still a lot of unknowns with the Supreme Court ruling and where public health, both at the state and local, will be going. Some of the things we've talked about in the Milwaukee County area is making sure that we continue to have that phased-in approach so that we are both building on the successes we've had under Safer at Home, but recognizing that that is not a state we can be in for the long term. So putting in place a phased-in approach helps us to control the timing, as well as control how much physical distancing we have in place at any given time. And then under those circumstances, monitor the impacts of that slowed progressive loosening of restrictions, looking at that impact on our data and making sure that we stay under those benchmarks, especially for the healthcare system, so that we can manage and care for the acutely ill and are not overwhelming those systems beyond their capacity. Our goal, and again, it's continued under a local plan, but also follows the Badger Bounce Back plan, is that it's really driven by data and the criteria that have been set forth to determine when we are ready to move into the next phase, so that it's not arbitrary and not based on timeline, but based on science and data that says it is safe and we have confidence that the next phase, we're ready for the next phase. And I think what you're seeing from the indicators coming out is, we have arrived at a steady state where we're getting closer to feeling confident that we're ready to move on to the next phase. And again, the importance of aligning with federal and state best practices. And then just to point out specifically in terms of workplaces, that public health would like this plan to include that connection and partnership with workplaces, so that we can put those best practices in place and make sure that we have the confidence of both the employers and the employees and customers that the practices in place will help minimize risk and prevent further transmission. We've got some broad considerations about healthcare capacity and testing, PPE, and all of those are part of a local plan that we would hope to stand up should there be the need to do that. So I'll end here and invite questions of the group.
Thank you very much, Ann, for that thorough overview. Dr. Raymond, I'll bring you back in. Chris, we have questions.
We do. The first one could be, I suppose, for any one of the three of you. A lot of people pointed out that 5 of the 6 state gating criteria have been met now. What is the significance of that? And what is the significance of the downward 14-day trend in influenza-like symptoms? And why is that criteria important?
Dr. Raymond, Ann?
Go ahead, Ann.
Okay, I think that the gating criteria being at a state of green from the state level is very promising. I think that what we've seen even yesterday with the governor reducing some or loosening some restrictions for retail establishments is also a good sign that he's focusing on those gating criteria as well and making some turning up the dial. What I think will be important to see is the impact that those loosened restrictions have on future gating criteria. So we feel that those measures are promising in response to the gating criteria, rather than just staying with Safer at Home, thinking about what can be loosened so that we can start to see some progress, both at the economic level as well then in terms of the health impacts of those loosened restrictions. For
the gating criterion of flu-like symptoms, remember, we started this pandemic when we were at the tail end of our influenza season. And if there's a second wave, then we'll likely also have coexistence of influenza. So this was really a hospital capacity gate to make sure that we weren't simultaneously overwhelmed with both flu and COVID-19.
Thank you. We had another question about an inflammatory syndrome that's being seen in children. Are you familiar with that, and are we seeing that here?
I'll begin, and maybe Dr. Raymond, you can add more. In terms of the seeing Dr. Raymond can talk specifically about the situation that you're referring to, but in terms of us seeing this situation here, we have not in our local area seen that, but we know that there are COVID cases amongst children, so that'll be something that we'll obviously be wanting to monitor going forward.
Yeah, very few cases at Children's of COVID-19 positive hospitalizations. But because it's happened in New York and other places, we do have to be on the lookout here for that multi-organ inflammatory syndrome in kids.
We had a question about some national reporting on a spike of cases in Racine County. Do we know what's happening there?
This is Anne. So I'm not specific on what the spike in cases would be, but if it follows the trend of other places, it could be potentially a workplace setting or a long-term care setting. Those would be my guesses, but I have not talked directly with Racine to find out what's happening there.
Yeah, I spoke with the mayor this afternoon from Racine, and they're very concerned and are trying very hard to bring in extra amount of testing capacity so they can find out what's happening there in the community.
Another question about what role technology can potentially play in contact tracing.
I think technology can play a great role in terms of finding people. We already see it with kind of creative approaches through social media and whatnot. I think, though, that there's no stand-in for that personal face-to-face in our contact tracing investigations. Really, it's about that relationship with the people and helping to answer questions and help people problem solve how they're going to cope with a quarantine or an isolation period. So I think technology is going to be helpful in finding people and identifying people, but I think that contact tracing process is still going to be a one-to-one connection.
Then what elements of social distancing do you believe would be most effective as we begin to reopen the economy?
One of the key ones will be that physical distancing of 6 feet between people, and how do we implement that in a business setting, a retail setting, a school setting. Those will be the challenges that we face, is how do we keep ourselves separate when we're so much a society where we're together. So that will be a key one. Also, it comes down to the hand hygiene and making sure that we remember and continue to practice that good hand hygiene. So 2 of those together will be important strategies. And then wearing those face coverings is also critically important. Wearing them correctly so that they're not just dangling down by your chin, but being appropriately used and in place for when we're not able to do that social distancing.
Then finally, we had a question about the R number, the effective reproduction number. How is that calculated?
Yeah, I would turn that to Dr. Raymond and his MCW team. Do you want to talk more about that?
It's actually a very complicated calculation, and there's debate in the literature about the different formulas. And if people really want that information, just send an email or put it in the chat box, and we can send you the formula that we use at MCW.
Thank you to the 3 of you, and thanks to everybody who asked a question today.
Well, thank you, Dr. Raymond. Thank you, Anne. As we focus on tomorrow, we're going to be hearing from Charles Franklin, Marquette law professor. There's a new poll that's just out. And I think, again, thank you both for the information. My takeaway from this is that we're going to have to learn how to do all this and do it really well. As the job numbers come out Friday and we reflect on our national standing here, we will have wiped out all the job gains for the last decade. So we're going to have to figure out social distancing, the appropriate way to approach this, because we're going to need to get the economy back up and running. And I know that's not in conflict with the health outcomes. So thank you both, and let's have a safe and healthy afternoon, and we'll see you tomorrow.
Thanks, Tim. Thanks, Ann.